Morning, everyone. This is my intervention um, video. Basically, I'm going to be talking about kind of the assignments that we did, the assignment that we did last week, which was the intervention role play, and then talking a bit about um, the paper that I wrote, the intervention assignments, the written part. So for this video, I'll basically be talking about the treatment approach that I selected. So first of all, I selected cognitive behavioral therapy. It was advanced by Dr. Aaron T. Beck in the 1960s to 1970s. He discovered that um, people have impulsive thoughts, which are usually not true. And he could label them automatic thoughts. And then he found out that thoughts, feelings, and behaviors were connected. And then basically he was looking at reframing thoughts and then how that would affect feelings and then behaviors. Um, I was able to help clients be mindful about their negative feelings and behaviors, help them refrain, to help them refrain them to enhance their well-being emotionally. And then with CBT so far, it's been employed and being used with so many different populations. It's been used to treat alcohol use disorders. It's been used with juveniles. It's been used with other substance abuse disorders, marijuana, meth, um, benzos, and the rest. And then it's been used to treat older adults, middle-aged adults, teenagers, um, and then also, I guess it's been used to treat major depressive disorders, um, persistent depressive disorders, anxieties, and the likes. So, what the research shows, right, first of all, um, I looked at a study by Kiluk et al., and then it was looking at the effectiveness of using CBT to treat old adults who have alcohol use disorders. And so looking at treating them digitally and trying to see if it was more effective, whether treating them digitally um, or in person. Basically, it found out that there was no statistical difference in treating them digitally or in person. And the study, at the end of the day, concluded that CBT was a good approach, whether it was utilized in person or digitally for adults who had been diagnosed with adults with alcohol use disorder. And the age group there was people basically like 45 years, I think, to like 60 years old. And then there was another study by McGill and Ray. Um, Basically, their own study was a meta analysis, meaning they were looking at different other studies and kind of categorizing and finding out where CBT was and the population CBT was most effective in treating. They found that it was that CBT was effective in treating women, um, treating people with marijuana use disorders. However, even though they said them saying that it was more effective does not mean that it was not effective at all in treating men and other populations. We just found that it was statistically it was CBT was a little more effective and more significant in treating those specific populations. And then I looked at another study with Huey Jr. et al. And then basically it was just looking at um, how CBT has been used to treat culturally diverse populations. And what they concluded is that, that there had been results that showed CBT was effective in treating culturally diverse populations, particularly after a 12-month follow-up period. However, there weren't many studies that had been conducted on the effectiveness of using CBT to treat culturally diverse populations, and also that there wasn't um, enough studies on how medical and mental health professionals had been trained to use CBT. And then if we didn't know how they were trained, it made it a little more difficult to know what you were actually measuring and how they were using CBT to treat their populations. And then also then not knowing how many professionals had been trained, so you don't even know if people are using culturally sensitive methods in CBT to treat their clients. And then also when you don't have basically those numbers, then it makes it difficult to have like the data to do research on how culturally sensitive CBT is being used because you just plainly do not have that data of how CBT has been taught, the techniques people are using. Like, are you looking at the same thing? Your data just basically doesn't become reliable and it's not valid. And then it says the technique I selected. So the technique I selected is I selected coping skills with Mr. Jacob Smith. So Mr. Jacob Smith was able to identify that using alcohol um, was what he was using to cope um, with his persistent depressive disorder, which occurred after losing his friends and friendship network after he retired from his job. So he was then we were looking at his thoughts, feelings, um, behaviors, and then trying to reframe to have more positive coping skills. So Mr. Jacob Smith in the role play video was able to identify um, his family as strength and as people who, when he's around, could be a coping skill. He also identified like a day treatment program as a positive coping skill. He also mentioned eventually when he's able to get medication would be something that could be used as a, I guess, a coping skill. And then also, I'll say that worked effectively. I'll say that worked effectively because it gave Mr. Jacob Smith um, his self determination as the social worker. I wasn't, unlike the first video, I'll say I was less directive. Um, there was self determination where he was the one who recognized the coping skills that he needed that would be effective with him. I wasn't using a one size fits all because the client is supposed to determine their line of care and then what will be most effective for them. And then because with some research, it says like the client is the master and then about their own lives. And then as a social worker, you don't want to be directive and not be considerate of uh, what the client is saying and what best works for them. So I would say in using not just using coping skills, but then using it in a way where Mr. Jacob Smith was the one identifying what he found helpful and what had been negative in that sense, then it led to more um, active listening on my part as the social worker. So I was just listening and then trying to help with resources that were in line with the coping skills that he had identified. And that's all I have. Thank you.